back to Dr. Noah's YouTube update and just kind of going through the literature last week, and this is scientific literature, not the drug literature. This simple supplement can cut your risk by nearly half. Now this was published in the American Journal of Cardiology, November 10th, 2011, not 1950, but 2011, showing that taking vitamin D, and now these are cardiologists, these are about one of the biggest drug doctors out there. In this particular type of scientific journal, it stated is that people that have deficiencies, and we know, actually stated in here, that 70% of people are deficient. Now and that's using the old standard of vitamin D evaluations of 30 or less is deficient. Anything more, the more current from University of California, San Diego shows that should be between 50 and 70 units in terms of vitamin D. It would be 98% of deficient. They state that there would be a 300% more likely to die if you're deficient with vitamin D. So these are drug doctors, cardiologists with cardiovascular disease, showing the importance of a very simple type of nutrient, vitamin D3, something that you need to have your drug doctor or natural health provider test in terms of doing what's called a 25-hydroxy D3 test and getting a number. And like I said, it should be between 50 and 70. This was kind of an interesting study. MRIs have no effect on epidural steroid outcomes. Now this is a kind of, once again, a little con that goes on when people have back pain. What they do is they do an epidural, they use some type of steroids, and sure, steroids work, but it's like drinking, 3 bottles of Jack Daniels. Sure, all the pain will go away until the drug wears off. And there's been 2 scientific studies with double-blind placebo studies, so it shows that just the mere act of having a doctor stick a needle into you, people think, hey, that's going to help me and make me better. It has nothing to do with the drugs that causes immune dysfunction, osteoporosis, destruction of tissue. And so now what they've done to add even more insult is that they do an MRI and thinking that's going to make it better. And in this study here, oh geez, Johns Hopkins Medical School. See, these are all from drug doctors that want to really try to reveal the crap that's out there, costing us $1.2 trillion in fraud that occurs by your drug doctor doing this crap that doesn't work. Like, yeah, I got a cold, let's put you on antibiotics. Antibiotics never ever work on colds or viruses, never ever. They should in fact have their license revoked immediately, because if they're in school, they should have failed that test and never become a doctor. So in this study showing is that, yeah, it's a waste of time and costing $3 billion more every year. Now that's $3 billion that could be spent into something else in terms of good health and happiness there. Cancer screening is overdone in older adults. I mean, this is really barbaric. This is where, and we've talked about the study that just came out, where the last month or two, these drug doctors, just to rip people off to make more money, are doing these heroic, so-called heroic type of interventions that they know is worthless, costing billions of dollars. Well, here's another study. Archives of Internal Medicine, December 12th, 2011. Yeah, cutting the edge here. Showing is that it's disgusting for people to be able to continue to be having cancer screening. Now we've talked about, and we'll talk about another study, the country of Canada has now started to, forget about breast cancer screening because it's garbage. But we'll talk about that here in a moment. Is that for those 75%, sorry, not the 75, or who are 75 years and older, stop this nonsense. It costs billions of dollars and it doesn't do any good. It doesn't do any good, as we'll talk about, from ages from 40 to 49. So stop this madness, ripping people off that they don't have it. Here's a study, mammograms for women in their 40s. Canada doesn't recommend it because, yeah, the science, this is science, not some info commercial, so drug doctors that have a mammogram piece of equipment there to make, $300, $400 a pop, or my favorite one, gee, come on in, they're free. Well, there's nothing free. They take tax dollars, they pay these criminals the $300, and then, then people come in and have the mammogram and thinking everything's all happy. So women aged between 40 and 49, not recommended because, yeah, there's no science. Next study showing, as we talked about, using chemotherapy. Now chemotherapy, as we've talked about, the largest study ever done, 900 clinical trials showing at 5 years it increases survival rate by 2.1%. I don't know any other industry that can, once again, rip off people billions of dollars and have a 2.1% improvement on anything, whether or not it's improvement of your car, of your house, but and when it comes to your survival, how cruel can you be to these people that this crap doesn't work? Well, this is just another study that came out that we know what's called chemo brain. Well, you know, of course, the drug proponents of that, the prostitutes that are paid by the drug companies to tell you that chemotherapy, yeah, that's okay, this is great, this is effective, and now they're able to actually show using a special type of technology in your brain, when you do chemotherapy, yeah, it tries to kill everything in your body. So how does that get you health? It doesn't. And this was only published in where? Stanford Medical School. Oh my goodness. What do they know? They're only one of the top 5 medical schools in the world. And then show when you have this crap done and your BS drug doctor tells you that, you know, you can't be having anything with your brain because chemotherapy, once again, is very controlled, and I'm a real doctor and a scientist. Well, this was published in Archives of Neurology, December 2011. Nice. Oh, here's a fun thing. Every time you go to the hospital, 4 out of 10 of the drugs are used wrong. Oh, that's nice. 40%. So you almost have a 50% that these, once again, these criminals there that you're going in, they don't even know what they're doing. They're giving the wrong drug, wrong time, wrong dose like that. So that was nice. And so that was kind of a fun type of little outcome in terms of, you know, basically making you feel happy when you spend $10,000 a day and they don't even know which way's up. So 4 out of 10 drugs in the hospital are done improperly. Here's a fun one that just came out. The drug industry is now #1 in terms of being criminals. There used to be the military-industrial complex. That's, you know, where they spend, you know, $4,000 for a toilet, and, you know, a little bolt calls $18,000 because they just rip people off because it's the military. Now the #1 industry is the medical profession. So that's when you go into hospital and a bottle of Tylenol, which is crap anyway, costs you, you know, it's $100, where you can go down to another box store and get it for $3. So now that just came out in Public Citizens, December 16, 2011. Here's a nice study from a poison journal showing after 27 years. Now this is a poison central clearinghouse where anytime anyone gets poisoned or basically takes something that either hurts them or kills them, they have to record that. It's actually by a law. After 27 years, how many deaths? Because we always hear vitamins and herbs and things are very dangerous because, you know, as your drug doctor, you know, they don't have the scrutiny. Well, they found out how many people died. 0. Now, how many people died of the drug doctor's drugs? These are prescription drugs, not illegal drugs. This isn't overdoses. This is your crappy drug doctor giving you crap that doesn't work. How many people did it kill? 3 million. So 0 to 3 million. Yeah, and that's what you want to do and spend your money and go and be all kind of scared. Oh, I don't have health insurance. I don't have my drugs today. Yeah, well, it'll probably save your life. There's a classic study done back in the 70s where the whole country of Israel, the doctors there were unionized. I don't know if they still are, and they took a strike. Guess what? Death rate went down, not up because, you know, oh no, I don't have my drug doctor to do all their magic voodoo stuff. Well, that's what exactly it is. No science, and it hurts people. So that's a good one. So vitamins and minerals and herbs, yeah, that's scary. No one's died. Yeah, take your, you know, your crappy type of drugs, and once again, 3 million people died. Can you imagine? 30 people die of getting food poisoning from melons, and now they want to shut down the whole industry. But it's okay, 3 million people, and people run to the drugstore. Give me my prescription. Give me that crap. Nice.